Good morning. Thank those of you who are here for waking up early. It's a pleasure having you here with us today. We decided to have a symposium on pandemic preparedness well before the recent election and the consequences of that recent election. And I'm just going to take 2 minutes to remind us all that this really is no ordinary time. And I use that title that came from Doris Kearns Goodwin's book on FDR during World War II. This is a different no ordinary time, but in fact, no less worrisome. I think that we are facing a time when our social and political fabric in our country is in danger of unraveling. And it's not a time for us to sit back as though this is a spectator sport. It's a time when we talk to one another and exchange ideas and thoughts and plans for how we, as a medical healthcare community and scientists, are going to deal with the safety of our nation. And I think that having this symposium today is sort of just to tell you how it is. Where are we? What's going on? What do we have to do? And we're going to focus on antiviral drugs, vaccine development, tests and surveillance, and the responses of the human immune system, which has risen up as a critical event in taking care of our responses to infectious diseases. And finally, how to prepare our nation for emerging infectious diseases that are clearly not only on the horizon, but are encroaching on shore right now. So with that, I won't go much further. You're going to hear a lot more about this as the day goes on. And let me just introduce our Dean of the Medical School, Lloyd Minor.
Well, thank you very much, Lucy. And Lucy, on behalf of all of us, thank you for your leadership of the Beckman Center, your leadership as a scientist, as a great thinker, as a great advocate for science, and your inspiration that you've provided to all of us who've had the privilege and have the privilege of knowing you and working with you here at Stanford and, of course, around the world as well. Now, there's some debate, of course, as to whether or not the pandemic is officially over, but I think we can agree that its effects are far from over. And as Lucy said, you'll be discussing today many of the things we learned, but also the important scientific work that we have to do and the important scientific opportunities that we have today to do that work in a way that yields advances so that we're better prepared for the next pandemic than we were for this pandemic. You know, there are some events, some dates, some times that stick out in your mind for years and years and years. At least I found that in my life. And certainly indelibly ingrained in my memory is the morning of March 6th, 2020, Friday, March 6th, 2020, at around 7 a.m. when I just finished exercising at the gym, was in the locker room getting ready to come in to the office, and my cell phone rang, and it was Dr. Norm Risk, who at the time was the Chief Medical Officer for Stanford Healthcare and Senior Associate Dean for Clinical Affairs in the School of Medicine. And Norm called me to say that overnight, one of our faculty had been admitted to the ICU at Stanford Hospital, and that because of the PCR that just days before had been given emergency use authorization by the FDA, developed here by Dr. Ben Pinsky, because of that, we knew, as a result that just came in a few minutes earlier, that he had SARS-CoV-2 and that he was not doing well. He was increasingly short of breath. His blood oxygen levels were dropping, and that they were concerned he might have to be intubated. And that was the beginning. That was the beginning of the change in the world. I'd known about, I'd followed the literature of SARS-CoV-2, and in a very prescient fashion, indicative of the ingenuity and dedication of Stanford faculty, I'd gotten a call in January, late January, from Tom Montine, our chair of pathology, that Ben Pinsky, the director of our virology lab for our hospitals and also a professor in the Department of Pathology, thought this was going to be big, that what we were seeing little bits and pieces of at that time in the state of Washington, certainly what we were hearing coming out of China. The sequence of the SARS-CoV-2 virus had just been published in January, and that Ben wanted to start developing the primers and scale up for doing PCR testing, and that there needed to be some budgetary allocation to make that happen since it wasn't covered in the routine budget of the clinical virology lab. We, of course, said, go to it, and thanks to Ben and his amazing team, we had that assay up ready to run, and we were able to make the diagnosis. Now, fortunately, the story for that faculty member and for many others has a good ending, and that they recovered completely. We were able to get compassionate use authorization for remdesivir. As to whether or not that had that much of an effect, I mean, that's one thing we still need to study. And of course, just a little bit over a week after that faculty member, we had others on camp. Well, even before a week, we had others infected, and the university made the momentous decision to close the university, the first time in its history. And then we worked collectively to make sure we were able to get the labs back up and running as soon as we could, and of course continue online educational programs. It's easy and it's appropriate in some respects to move on, but also I don't think we can ever forget, and we shouldn't ever forget. And other things stand out in my mind too. What stands out on the supply chains for healthcare delivery systems prior to COVID had been based upon a just-in-time mechanism. Hospitals, other organizations did not maintain large inventories of supplies. And there were lots of reasons in terms of economy, of not having storage piles, and also not running into risk of things becoming outdated. But then, of course, where were the supplies of PPE? Where were the other supplies? The RNA extraction kits, for example. And seeing how our community came together to address those problems. People like Amanda Chawla, who leads the supply chain office and activities for our hospitals, working tirelessly to find PPE, developing hospital consortia, even contracting with a 3D printing company when the swabs we needed to use, which of course can't use cotton, to take a specimen to look for SARS-CoV-2 were in short supply, and 3D printing our own and then making those available to others. There were countless individuals that really stepped up in the moment and showed the very best of the spirit of this institution and of who we are in healthcare and biomedical science. And I also want to do a shout out to our volunteers and people who've supported Stanford in so many ways. I recall a conversation that Peter Kim and I also had early in the pandemic, and when Peter said he had an idea for a novel vaccine for SARS-CoV-2, but that he, of course, needed some support to make that happen. And then just a day later, I got a call on a Saturday on my cell phone from one of our donors who said, look, I know you and your team are working really, really hard on this, and this is a big problem, and let me know how I can help. And we were able to match that person with Peter and really very rapidly get the support that Peter and his group needed to start the work on that vaccine. And of course, now that's led to a company, and that vaccine is in clinical trials. There's so many things that we can look back on during that time, and I think collectively be proud of how our people came together to address what none of us were prepared for, right? I mean, there was a call that one of our faculty members got from General Mattis early on in the pandemic. This this faculty member had worked with General Mattis in the military, and General Mattis said, take care of yourself, take care of your people. And then the last thing he said was, remember, this is what you train for. And I can see a general telling their troops before you go to battle, because they did. They trained to be defending our country. But the fact is, none of us in healthcare or biomedical sciences, life sciences, really prepared for a pandemic. I mean, fortunately, we had people like Bill Gates warning us. We had others like Lucy, who certainly knew the risks. But in terms of actually what we would do and how we would do it, we were having very much to learn in the moment and respond to situations as they came up. And it really takes special individuals to have the foresight, the fortitude, and the empathy to lead during incredibly challenging times. And I think we had those here at Stanford and also at so many other places around the country and around the world. Now I want to close with one more thought. As we experienced firsthand, and still experience related to this pandemic, there will be and there are differences in opinion when it comes to managing a local public health crisis, and certainly when it comes to managing a global pandemic. But I firmly believe that it's important that even when we feel like we don't have the time, even when we feel like we know the right thing, it's important that we take the time to listen to those with different viewpoints and have meaningful conversations with them. As scientists, as physicians, as public health experts, we need to go where the evidence takes us. It's incumbent on us that we spend the time to explaining and educating to enable the public to join on that journey, and to recognize that that journey is not going to be a straight line. It's going to twist and turn. And how we communicate to the public uncertainty, because there will be uncertainty. There certainly was with SARS-CoV-2, and there will be in future public health crises as well. How we communicate that this is the best we have, the best we know at the time, but it's likely to change, and earn trust through that communication is going to be really important at how we rebuild trust in the future. And now today we gather to learn from each other and better prepare us for future public health crises. And I want to thank all of you who are here today, especially our speakers and the organizers of the conference, for sharing your research and your insights and your wisdom. And I want to thank every one of you for joining today and for the important work you're doing in your everyday lives and in the work you're doing to prepare us for the future and also to sustain the excellence and build the excellence that's gotten us to where we are today. Thank you very much.